One of the first questions that a patient asks me when I tell them that they need to have a gum graft is, oh my gosh, what are you gonna do to the roof of my mouth? It's a really common fear, and a lot of patients have had really bad experiences with other providers. I wanted to talk to you about what we actually do and how we harvest the gum graft from the roof of your mouth, show you some photos, and show you that it's really not so scary and not as painful as so many people make it out to be. Here is a patient immediately after we took a graft from the roof of their mouth and everything is closed up. So let me talk you through what we see here. So this line right here is the single incision that we make to take that graft. This is literally the width of a scalpel blade. It's one cut, so it's really, really minimally invasive. And we can see that the two edges of the wound meet together perfectly. You have no open or exposed wound at all. Over top, we have these two sutures to close this. Those are those X's that you see here. I know that these look really red or look scary or may look like cuts. Really, this is dissolvable suture material. How those dissolve is they absorb your saliva. That means they also absorb blood. They start off as like a brownish tan color, but kind of immediately after the surgery, they absorb a little bit of that blood from the procedure, so they look much worse than they are. A lot of patients don't understand this when I explain it to them. How are we able to take the tissue graft out using only one incision? They're like, I thought that you had to take a whole big chunk out or shave a big piece off. They're expecting to have this big open wound on the roof of their mouth, but really that's not what we need to do at all. It can be kind of difficult to understand just with me kind of waving my hands at this photo. So let me use an envelope as an example. So this is just a normal envelope. We make that incision right here. Think of it like using a letter opener. We open the letter, and then what we do is we elevate a little bit underneath that envelope, and then we pull out the envelope graft, okay? So this is still a pocket that we then close and suture like you'd see here. We have the graft, but the whole roof of your mouth, that outside piece, is completely intact. 2 weeks later, this is how things healed up. So we can see that those sutures that were in place have dissolved. They're dissolvable sutures. That's what we expect. Everyone's a little bit different. Some last around 5 days, some last closer 10 to 12. It's almost like a scab. They fall out when they're ready. With that incision that we made, we can see that almost the whole thing is completely sealed up. We just have a little bit of scabbing here, but overall, all of that outside aspect of tissue over the top of where we took the graft from, completely intact. Other than this little tiny incision, you'd never know that anything was missing or anything was gone. No big divot. Everything is healing beautifully. So when we ask our patients how they feel in the immediate days after the surgery, up to like 2-3 weeks later, what they say is that they don't really experience pain from this site, which is great. Maybe a little bit of numbness, or the patients that reported any sort of discomfort compared to like a pizza burn, like if you ate a really hot piece of pizza and got a little bit of that cheese burning the roof of your mouth. But overall, nothing that, an over-the-counter pain medication couldn't manage. As this is healing, underneath where we took that graft from, that missing piece, fills in over time. So we actually have patients that need gum grafts in several places throughout their mouth, and we can actually go back into this site and take another graft as soon as like 8 weeks later. It completely fills in. This is like an unlimited supply of gum tissue for us. So there's no concern that you're missing something that you're not going to get back.